Hello everyone, welcome to Micro Mahasutra. The general microbiology is what is we are discussing, and the topic of discussion for today is fetal infections. Mostly fetal infections is neglected topic, but then it is very important, be it any examination. This is your microbiology faculty and mentor, Dr. 𝗵𝗺𝗺. So fetal infections, initially we used to remember with the mnemonic torches, but now it is not torches, this is cheap torches. So what do you mean by cheap torches? So cheap torches is C for chickenpox and shingles. Both of them are caused by varicella. Then you have got hepatitis. So remember A and E, both the vowels, they are coming from food. Okay, so A and E are from food. So basically B, C, D are the ones which are transmitted by the help of hepatitis B, C and D are fetal infections, and for that matter even E is also considered to be the cause of hepatitis in pregnancy, so it can also transfer, but the major cause for transfer is the food, and you don't have them generally in fetus. Next is E for enterovirus. So remember, very important thing, whenever you are entering in a wrong lane, okay, you are entering in a wrong lane, so there will be the police car, okay? So police car that is going to be there waiting for you. So P, C and R. So rhinovirus, 𝗲𝗵𝗵𝗺 and poliovirus, PCR. These are the important, this is the important mnemonic. Enterovirus, this is very important. Okay, coming on to A. What is A? A is for AIDS. Okay, so HIV infection. Then P for Parvovirus B19. Yes, you all are aware of my narcissism. I hope the psychiatry faculty will soon be using the name of the microbiology faculty. So Parvovirus B19, this is my name, this is the mnemonic. If you don't study well, so this is a slab cheek appearance which is seen in Parvovirus B19. Slabbed cheek appearance that is seen with Parvovirus B19. Next is torches, T for Toxoplasma, Toxoplasma gondii. Then O is other. So what are others? Group B Streptococcus. What is R? R for Rubella. What is R? R for Rubella. Then what is C? C for Cytomegalovirus. Then H for Herpes Simplex Virus. E for everything, the sexually transmitted infections, everything else, just like gonorrhea, just like chlamydia, just like human papillomavirus. You know that 𝗧𝗲𝗹𝗵 is a mnemonic for this E, further has got a mnemonic, and then S is the syphilis. So coming to the torches, which are actually the most important ones. T for Toxoplasma gondii. Gondii is somehow very well similar to Gandhi. Gandhi in Hindi is a word that we use for bad things. So gondii is Gandhi, bad. So bad cat, bad meat. Okay, you can remember like that. Bad cat, bad meat. Okay. So why bad cat? There's a saying that if a black cat is crossing your way, that's that's not a good sign. That's a bad sign. So bad cat, bad meat. That's the mnemonic. That means Toxoplasma gondii, Gandhi, bad is cat and meat. So Toxoplasma gondii is happening because of what? Because of cat and meat. So if you are having a cat, the Toxoplasma gondii is found in cats, and then you can suspect it coming from an undercooked or contaminated meat. Prenatal toxoplasma. Before the birth, the toxoplasmosis is diagnosed by amniocentesis. So what you do, you put a needle in the womb, there will be amniotic fluid, you take out the fluid, you check for the DNA of Toxoplasma gondii. This is the amniocentesis. And PCR, which we have already discussed in bacterial genetics, for Toxoplasma gondii DNA, right? We are going to check in the amniotic fluid. What are the clinical features? So can you see this specs? I'll try to zoom on this picture for you. See this picture now. So can you see these both circles? Eyes, this is a specs. So these both circles are eyes. So chorioretinitis. Okay. So chorioretinitis. Okay. Yeah, chorioretinitis. And then what is this X? Exo is toxo. That's why I have written like that. So toxo, I have got एक चश्मा बनाया मैंने. I have made a specs out of it. Toxo. So these eyes is for chorioretinitis. Then C for cranial calcifications. Other C is for cranial calcifications. And both these sticks, can you see these sticks? These sticks are making H. So hydrocephalus. So this toxoplasma chashma can make hydrocephalus, responsible for intracranial calcifications and chorioretinitis also. Okay, so this is important. And yes, definitely the diagnosis is confirmed via PCR, right? I have told you already. How will you see PCR? PCR of CSF of Toxoplasma gondii DNA. That means you take the CSF with the lumbar puncture from a baby. After that, you puncture I hope that you are aware of lumbar puncture. You take out the CSF, you operate the sample for Toxoplasma gondii and in the PCR machine, and you will get it. Coming on to rubella. So rubella is transmitted transplacentally. Okay, this is transmitted transplacentally. Okay, from placenta it has come. So rubella is just a Valentine story. My favorite story, I'll teach you. So on a fine day, Valentine's Day, 14th of February, every couple roaming here and there. So what happened? One of my friend who was in love with her partner, एक rose लिया उसने. He bought a rose and muffins. Okay, so rose and muffins he took, and प्यार में अंधा, he was blind in love. Okay, he went to her home. I told him, please don't go. Don't go, that's not nice. Please don't go. He was not listening to me. Okay. He went there and dil de baitha, gave his heart to the beautiful lady. And now they are married. This is rubella. What does this mean? See, I told you, took a rose. That means R for rose, R for rubella, and blueberry. So there is a rash of blueberry muffin color. So this is called as blueberry muffin rash, which is happening. And the three important things. One, he was blind in love. So cataract. He was not listening to me. So sensory neural hearing loss. Sensory neural means 8th cranial nerve, which is supplying the ears, are gone. Dil de baitha, gave his heart out to that beautiful lady. PDA, patent ductus arteriosus. So there is a ductus arteriosus, right? So it remains patent. Normally it closes, but it remains patent. So the triad is these three. One is the sensory neural hearing loss. One is the cataract. Other is the PDA. Although blueberry muffin rash is seen in the rubella, but mind you, this is not a part of the triad. Okay. How will you check? You have to check for the maternal titers prenatally. You have to check for the maternal titers for immunoglobulins produced against rubella. Check for the maternal titers of immunoglobulins produced against rubella. Also, because my friend's mother said, "Tera to dimag hi chota hai. You have a small brain. You can't think. So her head size is small. Okay, small head. Okay." So how will you check for the heart defects? Echo. How will you check for the cataract? Ophthalmic examination. And yeah, there is a blueberry rash. Why? Because see, normally the blood is formed in the bone marrow. That is called as medullary hematopoiesis. But in the patients of rubella, there is extramedullary hematopoiesis that happens. Extramedullary hematopoiesis that happens. So see the vessels, the blood, right? They will come in the skin also, dermis also. In dermis, the blood will start to get formed, and definitely there will be bluish discoloration, which you label it as blueberry muffin rash. Treatment, please remember, rubella is not curable. Congenital rubella can be prevented by giving the by giving the vaccine to mother, but before pregnancy. Please remember, you have to give it before pregnancy, because MMR is not given in pregnancy. Okay. Coming on to cytomegalovirus, remember C and C. C for cytomegalovirus and C for common. So remember, cytomegalo, CMM. C, that is most common. Dirty brains, come here. CMMC, okay, most common fetal infection. Just like rubella, so in torches, TO is toxoplasma, R and C. Remember, both of them are transplacentally transmitted. Coming on to the next part, that is amniocentesis. Yes. So do you remember toxoplasma as well as rubella? So TO and toxoplasma and then your cytomegalo. Both of them are going to be diagnosed by amniocentesis. Then you have got some investigations. Rather than, I should say, you have got the clinical features. So see, CMV. V is ventricular enlargement. So in the brain there are ventricles. I hope the third ventricle, fourth ventricle, lateral ventricles, you know. So the size of the ventricles are going to get increased. Then you have got M, microcephaly. The head is going to get smaller. C for calcifications. There will be calcifications, but where? Near the ventricles. This is called as periventricular calcifications. Whereas, my dear friends, intracranial calcifications were there in toxoplasma. Okay, you got it? Great. What is the treatment you give in CMV? This is symptomatic treatment you will give it. Antivirals are not indicated for immunocompetent mothers, but are indicated where you have got neonates with symptoms of CMV. Okay. Coming on to herpes virus. So remember, herpes is of two types, herpes 1, herpes 2. 1 is above the level of waist and 2 is below the level of waist. Just like vagina, anus, all of them is going to have HSV2, and HSV1 is having just like oral HSV, in hands, papilla and everything. Okay. So basically below the pelvis is 2 and above the pelvis is 1. Remember that HSV2, that is below, it's having in vagina. So because it is there in vagina, what is there? It is going to get transmitted transplacentally also, but major is transvaginally because it is going to be present there. Okay. Remember, wherever HSV come, herpes simplex, wherever herpes come, this is a dicta which you have to remember. Yes, which you have to remember that what is the dictum? 1, there is going to be painful ulcers. It can go to brain, and the treatment of choice is going to be 𝗖𝗵𝗵𝗆. So there is a club called as HERA. There is a pub, not club, pub called as HERA. So HERA means HER for herpes, A for 𝗖𝗵𝗆, P for painful ulcer, and B for brain. Okay. So this is the mnemonic to remember, that it can go and cause ulcer, can go to brain, right? And the drug is given is 𝗖𝗵𝗆. This is very, very, very important question. Okay. How will you check? So it can be diagnosed with the polymerase chain reaction and direct immunofluorescence also. Okay. Remember, the antiviral therapy with 𝗖𝗵𝗆 at 36 weeks of gestation we are going to give until the onset of labor, right? It reduces the risk of neonatal HSV. Okay. So the women with active HSV at 36 weeks, if you are not giving 𝗖𝗵𝗆 or something, they are scheduled for cesarean section. Why? Because the exposure is having transvaginal exposure is maximum. Okay, that's why we do the cesarean section. HIV, transplacentally, during childbirth, and breast. So see, there are 3 things. 1 is antenatal. So if it is coming, or rather than antenatal, I should write antepartum. That means before delivery, it can transmit via placenta. Intrapartum. That means during delivery, it can go through the contact of mother's blood and fetal mucous membrane. Then you have got postpartum, breast milk ingestion. Okay, so this is the HIV. Antepartum, intrapartum, postpartum. So if the mother is having HIV, please don't breastfeed the baby. Okay. Coming on to the next part, what are the signs of HIV infection? Chronic diarrhea. Because, AIDS is what? AIDS is the immunodeficient disease. Immunodeficiency. So what will happen? Recurrent bacterial infections. Okay. Then failure to thrive. Baby is not going to gain weight, and the baby is not going to grow. Okay. So how will you check? This is most important question. You have to check a blood PCR testing for HIV. This is a previous year question, that you have to do a blood PCR testing for HIV. What is the treatment? Remember like this: AIDS has S in the end. S is similar to Z, and Z is similar to S. What does that mean? AIDS, you give 𝗲𝗲𝗵𝗵, then S for 6, that is given for 6 weeks. So 𝗲𝗲𝗵𝗵, 6 weeks. It is given post exposure, right, in the neonates. Coming on to syphilis. Syphilis is caused by Treponema pallidum, but it itself is a big topic, so we will discuss in detail. Just now remember that PQRST, the mnemonic, PQRST, S and T comes together. So S for syphilis, T for Treponema pallidum, and what is P? P for penicillin. So this is the drug which is given, P for penicillin, parenteral penicillin. Okay. Now you all will comment down and tell me which is the treatment of neurosyphilis. I mean, which penicillin is given in neurosyphilis. So this is it of the fetal infections. I hope that you will become a good pediatrician, a good obstetric and gynecology person, and are going to save the little kids from the little infection. Thank you so much. Comment down your love, blessings, and support in the comment section and your feedbacks. Thank you.